give you one more sound check. Can you hear? 1, 2, 3. I will go ahead and get started. I'm Quinton Lucas, Mayor of Kansas City. We wanted to talk about a few things. First of all, a number of tragedies that have befallen the Kansas City Fire Department, the City of Kansas City, and our entire region. I'm joined today by our Fire Chief, Donna, by representatives from the Local 42 Union, Local 3808, to talk about some of the lives we've lost, some of the efforts we're taking, and the impact that this has had on our public safety community. But I wanted to talk first more broadly about COVID-19 and its impacts in our community. Yesterday, the Kansas City region added 1,300 new COVID-19 cases, 1,300, bringing the total to nearly 74,000 total cases of COVID that we have seen in the metropolitan area. 9 people died yesterday, in addition to the individuals we'll discuss today. That's for a total of 949 deaths in our region. The weekly average of new cases is now at 1,282. Last week it was 1,078, and 2 weeks ago it was 765. Our COVID-19 infections are growing. They're growing out of control. It's a significant threat to our public safety, our public health, and a tremendous threat to our first responders and frontline workers, several of whom have given their lives to this city, dying in the line of duty to make sure Kansas Cityans stay safe. In April, we lost EMT Billy Birmingham. Yesterday, we lost Fire Captain Bobby Rocha. Today, we lost communication specialist and paramedic Scott Davidson. All of them served this city for decades. All of them worked hard and were courageous for the people of Kansas City, and we honor all of their courage and all of their sacrifice. In addition, Kansas City government has lost Water Department employee TJ Morales. We honored him recently at City Council, and all of us have a desire to make sure that we don't see more families, don't see more individuals have to deal with this terrible disease. Weeks in the hospital, families not able to see you, and we know that there's that important impact not just for those in public safety, but also for all of those who've been touched by COVID-19. A few reminders about the orders that we have in Kansas City. And I'm proud of Kansas Cityans thus far because I believe they followed the orders well. Indoor dining, indoor drinking, indoor consumption opportunities end at 10 p.m. That's to keep people safe. That's to keep folks from spreading COVID-19 late in the evening. That's to make sure that we have fewer interactions with folks we don't know. We continue to ask all of you to change or cancel or postpone those Thanksgiving plans. There's no reason to take that risk right now. And we are seeing this impact increase every single day. And importantly, we encourage everyone to stay in groups smaller than 10. Please make sure that you are ones that are in the front line of the defense against COVID-19. Right now, it's not just about nurses or firefighters or paramedics or doctors or mayors or health directors. It's about all of you. It's about the steps that we need you to take to keep people safe. One other point, and then I'll turn it over to our fire chief. This Friday, I went to Fort Leavenworth and visited with U.S. Army leadership, who talked to me about their response to COVID-19. They, too, have seen that wearing a mask makes a significant difference, something that our United States military has now mandated for some time. But they're also dealing with a growth in cases because in some ways it's impossible to keep people from coming on base sometimes, some of whom are asymptomatic, some of whom have led to the spread of COVID-19. Please, keep our soldiers safe, our paramedics, our firefighters, our nurses, our police officers, everyone in our city, your relatives, your friends. And please make sure you wear a mask. You try to curtail a lot of your outdoor activity, your out-of-home activity, and remember that you are safer at home. So please, please make sure that you're part of our defense against COVID-19. I'll be followed by the fire chief, then our local union speakers. Thereafter, I'll come back for questions from all of you. Thank you.
Good morning. I'm Donna Lake, Kansas City, Missouri Fire Chief. And unfortunately, in the last week, last 2 days, we've had to announce the deaths of 2 of our frontline employees, Captain Bobby Rocha, and then also this morning, communication specialist and paramedic Scott Davidson. And then, as Mayor Lucas said, back in April, we lost Billy Birmingham, one of our EMTs. Early on in this pandemic, back in early February, we began planning for our response to the pandemic. We started sourcing PPE early. That didn't mean we always were successful in that. We were able to, fortunately, working with the state, working with our other fire and EMS agencies, able to find sources for PPE. We developed policies and procedures and changed our whole way of responding to EMS calls and actually every call that we go on. The whole idea is how do we slow our pace down and protect ourselves as responders and protect the people that we are interacting with every day. We had to make drastic changes like shutting down our fire stations and our public education modules that we do on a daily basis just to help keep our responders safe, just to help keep the public safe. That doesn't mean that we're not going to continue to respond in the proud and professional way that our employees do on every single day that they're at work. We partnered early with the other fire departments around the region. When you look at the things that are going on, it's not just the Kansas City area that's affected, it's the entire metropolitan region. And so we meet monthly as fire chiefs and have those discussions and share policies and share best practices and procedures. We work with our medical director, we work with other medical directors, we work with our public health director, and we're also part of the multi-agency coordination group. And so really, this is a region-wide effort, not just a Kansas City effort. However, I say that just so that you all know that this is bigger than all of us. And even so, our department has responded professionally and has been at capacity on call volume on, our employees that have been exposed to COVID-19 and those sorts of things. And so it's been a delicate balance every day, as we meet and discuss, what are our next steps and what changes and what tweaks do we need to make. It's great to know that we've got, not only my fire command staff, but our union leadership and our city leadership behind us to help us, in supporting those decisions that we make. That doesn't take away the losses that we faced. It's difficult for those families, and all of us standing here, the fire representatives standing here, we're close personal friends with the people that we've lost. They're all tenured employees, so we grew up together on this department. We work together, we fight together, we live together, we eat together, we do everything like families do at work. And it's just, there's no words for the loss of EMT Billy Birmingham and Fire Captain Bobby Rocha and Communication Specialist Scott Davidson. And so, we know we're in a risky business. Again, just like when September 11th happened, first responders were on the front line then. In this pandemic, we're in the front line then. I would say that's expanded. I mean, if you look at hospital workers and other frontline workers, there's a whole group of people that are really fighting a hard fight. And so, the biggest way we can honor people and the biggest way that we can help prevent this spread of COVID is to do all the things that have been recommended: wearing your mask, washing your hands, social distancing, and really shortening and creating a little pod of people that you trust and that you can be around. And if that is just your immediate family for now, that's okay. And like Mayor Lucas said, if that's who you're going to spend your Thanksgiving holiday with instead of having the big extended family gathering, save that for the date that we can get out of this pandemic and that we can all come back together as friends and family. I don't know how else to say it when we continue to respond and move forward through the pandemic. It's just about, asking the public to help us protect ourselves as first responders as well. So thank you for your time.
I'm Secretary Treasurer for Local 3008 Chief Officers Union. I'm taking filling the shoes of President Clay Calvin, who is at home also suffering from COVID-19. I would just like to say I think the light's at the end of the tunnel, and this is a time to be vigilant. It's not a time to let our guard down. I think everybody knows, the vaccine is on the way. but this is the most important time now to do the right things, wear your mask, and stay safe. So, thank you.
Good afternoon. I'm Tim Dupin, president of the International Association of Firefighters Local 42. I represented the two members that passed away this weekend, and Billy Birmingham, who passed away last spring. It is with profound sadness that I had to report to our members yesterday the loss of Bobby Rocha, a fire captain and a beloved member of our department and our union. I would challenge anyone that had ever met Bobby for more than a few minutes not to have a great story about Bob. He was my friend. He was a mentor to many, and it is a great loss to this, not only this department, but every young firefighter that ever worked with him, and every firefighter and EMS personnel member that worked with him. We're truly heartbroken over that loss. And this morning, we had to again report the loss of communication specialist and paramedic Scott Davidson. Scott is, again, a great member and beloved member of the department. And these losses now, we can say, have affected every part of the fire service. No one is safe in our community, and no one is safe on our job from this virus. I'm truly concerned not only for my membership but for our city. As the numbers increase and the positivity rate grows, I had a report that the positivity rate in Kansas City is nearly 46%. That means almost half of the people that are testing for COVID-19 are coming up positive. Our healthcare workers, your EMS personnel, and your firefighters are exhausted. This virus is taking a toll, not only a toll on our physical selves, but our behavioral health. We ask you and the citizens of Kansas City to help us help you. Wear a mask, protect your families with social distancing, and honor the rest of us and your workers by doing so. We're proud to serve this community, and we didn't lose Scott Davidson, and we didn't lose Bobby Rocha, and we didn't lose Billy Birmingham. They gave their lives in service to this city. And we, again, are heartbroken for their loss, and will never forget their service. And we ask you to honor them with your thoughts and prayers, and also to, again, practice wearing a mask and social distancing and staying home if you can. My concern is that we are now at a crossroads in this virus. Last spring, if we had this rate, the city would have been locked down. We locked down the city at when we had 7% positivity rates, and now we're almost 4 or 5 times that. So I hope that you'll take it seriously, especially this holiday season when you have family home. Get tested early. Take advantage of the free testing sites in Jackson County and within the city of Kansas City. And take care of yourselves and your family. And kiss your children at night. And lift up a prayer for your first responders. Thank you.
One other thing I wanted to note before we go to questions, we may be speaking to you all again tomorrow. I'll have a meeting with the Director of Public Health, an area school district superintendents, other school leaders, The topic of the discussion will be relating to youth activities and other school-based activities, directions we are discussing and maybe talking about for the next several months in Kansas City. So we don't have final guidance there yet. We do expect to work collaboratively with our superintendents. 14 districts in Kansas City are represented, as well as private and parochial schools, and we'll have further guidance for you then. With that, we're happy to take any questions.
A question here, but for Chief Lake, if that's okay.
I'll go first, and then we'll tab out that way.
Mayor, you've seen in not only in Kansas City but surrounding areas resistance to wearing a mask. Can you speak to that and what that would mean for further restrictions if needed?
Yeah, our mask resistors, the anti-maskers, are not only distasteful, they're exceedingly disrespectful, and they're harmful to the people of this region. I saw, and it was sent to me a number of different times, I guess there's a gym owner in Lee's Summit who threw away his mask, I guess showing some level of machismo or bravado. I think it's foolishness. I think it's disrespect. I think it's exceedingly heartless. When we're talking about the fact that there are 3 good men who work for our fire service, 1 good man who worked for our water department just here in Kansas City, Missouri alone, people whose lives we've lost, and we're talking about 1,000 people almost who've died in Kansas City, to be so selfish, to be so really in some ways just awful in terms of how you're interacting with everyone around you, your community. I don't know how he sleeps at night. I don't know how others sleep at night. And I would encourage everyone, no matter your jurisdiction, to call your health department or call the 311 service or the equivalent wherever you are. I don't know the number for Jackson County, but I would encourage somebody to make sure you're reporting those violations. You know, the people behind me go to work every day, and they've been picking up folks who are COVID-19 patients. They've been working with folks the same way they did before, and they're putting their life at risk each and every day. There are frontline workers who have talked repeatedly about the exhaustion that they're having working these shifts, the crowds that they're seeing. At this point, it's not made up. This isn't political. We're past an election. This is about actually trying to save lives. You know, I've learned a lot more about both Bobby Rocha and Scott Davidson over the last few days, and they sound like they were amazing men. There are so many that are grieving today. I met EMT Billy Birmingham's family back in the spring, a large family, a boisterous one, people that deserve to still have their father around. So I would say to somebody who's pushing back against these mandates, which are really, really simple and modest asks, look in the mirror, think about who you want to be in the community you want to be in. Are we a place that's trying to save lives? Are we trying to take care of people? Or instead, are you just some incredibly disrespectful person who's trying to prove a point?
Mayor, is there any concern about lack of service as this virus has, impacted the fire department, the police department, and a lot of our first responders?
There's always concern. Absolutely. I mean, I know Chief Lake, however, has done impactful work to make sure that we're limiting the spread at our fire stations, for folks who are on duty, for our paramedics. I commend her for that work. We continue to do more work to make sure that we have police department compliance. I know the chief of police has sent out further notifications about wearing masks. And in many ways, we're trying to make sure everybody who's calling for public services knows that if you're calling 911 and you suspect COVID might be an issue, let them know. Our paramedics will still show up. They'll continue to do their jobs, but allow them to know how they can protect themselves. The same for our police department. And so that's much of what we're trying to pitch and that we're trying to do. You know, an issue that still remains is support for some of the costs that we have incurred. We continue to work with our county governments in Platte City, Liberty, and Independence. We continue to work with Jefferson City and certainly Washington, trying to make sure that we have more support for our frontline workers, our first responders, and we'll continue to try to do that to address this crisis as well.
Mayor Lucas, we talked last night about the guidelines. Under the new guidelines you announced Monday, there's a provision now where fire officials and EMTs have to wear masks as well on the job. Are those going to be enforced with the same penalties that are in Section 50-155?
Well, I think that there are probably going to be more significant penalties. If you work for Kansas City, you follow the rules of Kansas City. And I think Chief Lake has been very clear, Chief Smith has been very clear about what the rules and the guidelines are. I know that they will go through the processes by which there needs to be compliance. Let me also commend our organized labor leaders. Local 42 and Local 3808. They have worked hand in hand with administration here at the city to make sure that folks are keeping themselves safe and keeping the community safe. And I think that most every firefighter I've talked to, most every police officer I've talked to wants our community to be safe. So you will continue to see, I think, administrative level enforcement where it's necessary, but I hope we don't need a lot of it. In terms of enforcement more broadly in Kansas City, we continue to largely address businesses that are not in compliance. We don't usually stop people who are walking down the street. We try not to do that. But we certainly try to recognize that if there's a business or a bar or a nightclub that's not following our rules, that they are facing a few different things up to and including closure, which is something that our health department has done previously. Any other questions for you? If not, then Chief Lake.
Questions for you?
Has it gotten to a point, the spread on the department, that now asymptomatic firefighters and just members are having to work?
So, yeah, so we got to a point where, and we had planned for this early on in the pandemic, we kind of had certain levels and benchmarks that we had been monitoring this entire time. And so finally we were at a point where once we hit a certain level of people that had been off on quarantine and those sorts of things, what we do now is we implemented a mask mandate, and then with that, we're no longer, what we're doing is if somebody tests positive, then that person is off. And then we do our contact tracing that we do in conjunction with the health department and our department. And the people that have come in contact work with masks. Yes.
Question for you, Chief Lake. In Kansas, with the union there, they have some issues where if they come in contact with someone who's positive, or maybe they have like a few symptoms, if they take that time off without a positive test, they don't get that time reimbursed. Is that something that here in Missouri you guys are going to do for the firefighters? If they think they might be at risk in that gray period, you'll go ahead and let them get off and pay for that time off for them to come back?
So if anybody comes down with symptoms or shows symptoms or complains or points out that they have, they think they have symptoms, we send them for a test immediately. And we've had great, excellent compliance with people. As soon as they say they've got symptoms, we've had fantastic compliance with them going and taking a test immediately. Then they spend their required amount of time, 14 days usually off, and then they have to retest and come before they come back to work, depending. So if they've been fever-free for 24 hours without any aspirin or any type of medical assistance and symptom-free for 72 hours, then they can come back to work after that initial period and testing period. So
follow up on that. For asymptomatic people who have come in contact, because let's say you've got some positive tests at one of the stations, for the other people who have directly been around and were on that same shift, how is that handled as well? Do they continue until they show symptoms, or do they all get tested?
No, they continue to work. We do that contact tracing. We notify them that they have come in contact with somebody that tested positive, and then they work with them, either an N95 mask or a surgical mask on for their entire shift. So,
are you in the need for kind of like how schools are needing more substitutes? Are you in the need for more firefighters to help, that pressure that you guys are under to fill those spots?
I think that was part of the reason that we ended up going with our mask mandate a little bit earlier and starting to let people work while they were symptom-free and, wearing their masks. It's just like in the health care service and other services. And so, with that, we want to make sure that we have adequate staffing, and that's enabled us to continue to keep that adequate staffing.
With EMT, Birmingham, and Captain Rocha, will you be going back and trying to ascertain where they may have contracted the disease?
Yeah, that's already been handled and taken care of.
So do you have an idea?
So that's what they do. It's hard to say. Typically those sorts of things are traced back to either patients and those kinds of calls that they've been on and those sorts of things. And so we've done all of that as well. So
do you know?
Do I specifically know? No.
Does the department you think knows where they contracted it?
Yeah. So.
At this point, how many active cases do you have, and how many have tested positive for the virus since March?
Oh, sure. So right now we have 73 active positive employees, and then we have tested almost 2,000, I think, 1,200 and something maybe, 1,200 and something tests that we've given of actual COVID tests, but we've had about 2,500 that we've contact traced and done those sorts of things. Right now we have about 300 that would typically have been on quarantine potentially had we not had our mask mandate and made those policy changes. So, and overall, 201 have tested positive since the beginning of the pandemic. So,
Chief, Scott Davidson, in his role as a communications specialist, was described as the calm during the storm. Can you talk about his role and what that says about how, whether they're responding to calls or behind the scenes, how COVID has interfered?
Sure. So, a lot of times people forget about, all of the background outside of our fire trucks and our ambulances that are responding on a daily basis. And so, really our communication center is that first point of contact. And so oftentimes, those communicators, they're getting the person on the end of the phone when they, answer. That's the person that's upset, in a crisis, panicky, whatever. And so, our communicators take a lot of, I wouldn't say, in some cases, verbal abuse, but really just that panic and that excitement. And, when you have a loved one that's having a heart attack and you're trying to get help, you want it there yesterday, right? And so, that's what I'm talking about. And so, it's important for our communicators and for the public to know that our communicators are that first, contact with the fire service and EMS service. And so those communicators have to be able to calm that person down, get the adequate information and correct information that they need so that they can get help on the way as quickly as they can. And so that's a strain and takes a toll on those individuals that work in that communication center. So,
Chief, question
describe the morale of the department right now, losing 3 colleagues during this entire pandemic.
Everybody's devastated. There's no way that you can, we've known those 2 individuals have been hospitalized for a while, and this was always this was the worst case scenario, that they would never come out of the hospital alive. And, it's devastating. It's devastating to all of us. And for our employees every day, they still have to put on their uniform and, get on their fire truck or get in their ambulance and respond to those calls, and not knowing if today's the day that they may come in contact with somebody that is actively COVID positive, and for some reason or another, even with all of the PPE that we use, there's times that's just not quite enough because of the interventions we have to do on occasion. If we're doing CPR, if we're intubating people, if we're starting IV lines, that's a lot of close contact and with those patients. And so it's difficult on our employees on a daily basis. But after this, we're going to struggle with morale for a while on how do we recover. So.
I'm sorry to ask this, but do you know if either of them were on ventilators, Scott or Bobby?
I'm worried about HIPAA. So
what does that say about your firefighters, that even though they normally see a fire and they know what they're going to see, they're going into it, but now that it's this unseen virus they can't physically see visibly, but they're still, like you said, putting on those suits and those uniforms, and they're still going out to fight and do their part as first responders. What does that say about your...
I think it just goes to show about the character of those individuals that work for Kansas City, Missouri Fire Department and other fire and EMS agencies across the country. But really, our responders are, they are diligent and professional and well-trained and passionate about the work they do. Even in the case of EMT Birmingham, because of his age and potential risk factors, he was offered an alternate assignment, but that's not his character, and that wasn't what he wanted to do. And I think that's the big story out of, when we were, kind of mourning him, and more directly back in the spring, was the fact that, his heart and passion was to help other people ahead of himself. And I think that's what, when President Dupin just said, it's not that we lost him, they gave their lives in service. And that's the character and type of employee group that we have. So.
Chief Lake, question for you, and thank you so much for talking. I understand how deeply this affects you. But a question that I have is, how are these going to be enforced? Can you give specifics? As we talked about last night, just like the rest of us, they're tired of this virus. Sometimes maybe they don't want to wear a mask because they're home with their fellow firefighters.
Yeah, and enforcement is always an issue. Obviously, I'm not, mama bear walking around behind them and picking up their dirty laundry and that sort of thing. So, as much as I feel like in some cases, I feel so very protective of our employees. And And, we have a great partnership with both our labor organizations. We have battalion chiefs out there and the captains in the stations. And honestly, I think people are, at least our employees, what I've seen is more of them wanted the mask mandate than are against the mask mandate. And so, one, they'll self-police each other, and then, we have our own, mechanism for reporting if somebody felt that compelled to do so. And then we would just handle it through our normal process. So.
Chief, I'm not sure if you said this, but how many members of your department are currently quarantined, and how many are in the hospital at the moment?
We don't have anybody in the hospital at this point in time, and we don't have anybody on quarantine. We don't have anybody because of our mask mandate, and because,
Okay. And that mask mandate went in October 16th, is that right?
We changed our policy and did that at the very 1st of November, so.
Very 1st of November?
Yeah, I think so. Is that when we did it?
Question.
We'd have to look. But, yeah, end of October, 1st of November, so.
Got a question for you, sure, if you don't mind. Across state lines, their union president, J.J. Sema, has had some issues with COVID protocols with the fire chief. It seems like you guys are on one accord in lockstep. Talk about the communication level there and why things are working with this relationship.
We truly have a great partnership with both labor unions and the fire administration, as well as City Hall. We've worked hard on that relationship over years, and it has really been shown through this tragedy and this pandemic how well we work together. I've talked to JJ over at KCK, and we support his efforts. We've shared our documents and our situational reports that we do on a weekly basis. We send them to local 64 officials and have encouraged them to try to get those done, which they are. It's a completely different situation there, and but we are very supportive of our brothers across the state line, brothers and sisters across the state line, and their leadership, and wish that everyone had as great a partnership as we have here. It's not to say that there aren't bumps and there aren't difficult days, and there aren't times where we don't agree. But we work through our issues, and we work hard to come up with what's the best for our firefighters, EMS professionals, and logistical support personnel. I think the best thing we've got is that partnership, and the leadership that we have are all three of us, whether it's Clay Calvin or Pete here today, myself and my secretary-treasurer and all my staff, and the chief and her staff. We are all committed to trying to do what's right, especially during a pandemic, and trying to keep personnel on the streets, trying to keep them safe and keep our community safe. It's a balancing act that we have to work through on a daily basis. When we first started this pandemic, we were meeting daily for 1 to 2 hours a day. We now meet at least once a week with representatives from all the department in both unions, and quite often more than that. So I'm thankful for the partnership and the relationship that we have here, and that we're not going through what our sisters and brothers across the state line are going through.
Follow up. In talking to Sema, it seems like one of the major problems is that lack of open and honest communication. So a question, hypothetical, if you're at liberty to share, if I was a firefighter and I had a grievance about the COVID policy, what would be my protocol to make that grievance heard?
Well, our membership, and within our collective bargaining agreement, every member has a right to a grievance, a step one grievance. So even if the union doesn't agree with you on your grievance, it still goes forward to the administration. And the union has a process that can go all the way up to the city manager and through arbitration. So we've had very limited amount of grievances on through this pandemic on particularly in the issues directed towards the pandemic. We've been able to work out most and so far all of those issues in a labor management setting, which has been a blessing. Grievance procedures are very long. They're very difficult, and they're very costly, not only financially but also on a personal level, trying to get things done. So grievance procedures are necessary often, but they're not always the best in getting things done. And that the best way to get things done is having a good relationship and being able to speak to each other.
All right, this concludes it. Thank you so much.
Thank you.
Just let me know. Can you just leave her? Yeah.